Every single year, millions of Americans are forced to make an impossible choice: pay the rent or pay the medical bill. Not because they were irresponsible, not because they ignored their health, but because the system they were born into was designed in a way that makes getting sick one of the most financially devastating things that can happen to a person. Healthcare costs are now the #1 financial worry for American adults heading into 2026, according to Kaiser Family Foundation polling. And when you look at the numbers, that fear makes complete sense. The United States spends $5.6 trillion annually on healthcare. That is more than any other country on the planet, not just in total, but per person. The average American pays over $12,000 a year in healthcare costs. Compare that to Germany, Canada, or Japan, where citizens pay roughly half that amount, sometimes less. And here's the part that should make every American stop and ask a serious question. Those countries live longer, have lower infant mortality rates, and report better overall health outcomes than the United States. So where is all that money actually going? Because it is clearly not going toward making people healthier. When you break down where the $5.6 trillion flows, a picture starts to emerge. Hospital care accounts for the largest share, roughly 31% of all healthcare spending. Physician and clinical services take up another 20%. Prescription drugs consume around 9%. Administrative costs, the paperwork, the billing departments, the prior authorization teams, eat up nearly 34 cents of every dollar spent in the American healthcare system. That is not care. That is bureaucracy. Countries with universal systems spend a fraction of that on administration because there is one set of rules, one payer, one process. In America, hospitals employ entire armies of billing specialists just to navigate hundreds of different insurance plans, each with their own codes, requirements, and denial strategies. Over the past 2 decades, a quiet but seismic shift has taken place inside American hospitals and medical practices. Private equity firms, investment groups whose primary obligation is to generate returns for their investors, have been buying up hospitals, emergency rooms, physician practices, and nursing homes at an accelerating rate. Between 2010 and 2020, private equity acquisitions in healthcare increased by more than 300%. When a private equity firm acquires a hospital, the goal is not better patient outcomes. The goal is a profitable exit within 3 to 7 years. That means cutting staff, reducing services in lower income areas, increasing billing rates, and squeezing every possible dollar from the facility before selling it. Studies have shown that private equity-owned hospitals have higher rates of patient complications and increased costs compared to nonprofit or government-run facilities. Communities lose, patients lose, but the investors walk away with enormous returns. On the other side of the equation sit the insurance companies. The 4 largest health insurers in the United States, United Health Group, Elevance Health, CVS Health, and Cigna, collectively generated over $90 billion in profit in 2023 alone. These companies have a legal obligation to spend at least 80 cents of every premium dollar on actual medical care. But they have become extraordinarily skilled at finding ways to maximize what stays in their pocket. Prior authorization, the process where a doctor must get insurance approval before treating a patient, has exploded in use. Claim denials have increased, and the time patients spend fighting for coverage they already paid for has grown into a full-time burden for millions of families. The American healthcare system is not broken by accident. It is the result of decades of policy decisions, lobbying investments, and financial incentives that reward billing over healing. $5.6 trillion is an almost incomprehensible sum of money, enough to fund schools, infrastructure, and social programs many times over. Yet a significant portion of it flows not toward doctors and nurses and medicine, but toward administrative overhead, investor returns, and executive compensation. Understanding where the money goes is the first step toward demanding something different. Because until Americans understand the system they are living inside, the #1 financial fear will remain exactly what it is today: getting sick.